All right, now let's discuss this further. We're now joined via Zoom by Deputy Health Minister Dr. Sibongiseni Dhlomo. Dr. Dhlomo, thank you so much for your time this afternoon. So just, from that clip that we've just heard, the Health Minister obviously saying that, precautionary measures must be considered, but that there is no need to panic at this stage. Talk to us then about you being advised to ramp up the testing and vaccination. Talk to us about that process that you will be undertaking. When will that happen?
In fact, if you follow through, thank you very much for this space, Nati, and to the South African viewers. The Director General yesterday forwarded information to all provinces, to all heads of departments in the country to actually, among other things, do those two main important processes. One, to ramp up the vaccination processes. And somebody was even asking why that, because even if you are vaccinated, you still get the disease. But we also have scientific evidence that the disease that you get is not severe. It will not take you to the ICU. It will decrease the people who die when they are vaccinated. So we really would want to encourage all our people to continue vaccinating. In fact, Nati, added to that, we're just saying me and you probably got 2 vaccines and then 1 booster. We must go now for another booster. And we want to continue for the 50-year-olds who got 2 vaccines, a booster and another second booster. We want them to go for a 5th booster because we want to keep on improving the immunity against the COVID-19. The improving of a testing, as Mr. was outlining, if you actually have a flu-like illness, you cough, you sneeze, you just don't feel very well, please do err on the side of actually getting to be screened. And if we actually find you that you do have COVID-19 symptoms and you are probably vaccinated, then that would be a real follow-up to do. So that is one part also we are going to ramp up in the provinces, in the whole country, so that we do not go on the side of really locking down the country and then restrictions. Again, we want to impress that is actually based on the numbers of our people who are vaccinated and the numbers of people that are hopefully going to come up and vaccinate and get boosters again.
So if we look at what is currently transpiring in the world as it relates to this offshoot of the Omicron variant, which is called the XBB.1.5, it is concerning to note that, of course, that it has been detected in 37 countries, and of course, what scientists are telling us that it is highly transmissible. So if we take it back to South Africa, we know that the variant was discovered in the Western Cape following a routine test. A sample test. So talk to us then about what else do we know then about, its origins in this country and what scientists are looking at currently, because one wonders then if you heard what the minister was saying in terms of no travel restrictions will be imposed, even though we know that WHO in Europe is imposing restrictions to U.S. travelers. What then will happen, in this country, in as far as that, given just how many countries this variant has been detected in?
What's on our side, Unachi, is that we have been advised by scientists and we actually understand it, and we want to share with the South Africans that we are actually having a sub-variant of Omicron. And the vaccines that we do have and that we continue to use would actually be very effective against any Omicron subvariant, including this one, as actually picked up by the scientists. What they are advising us further on is like, if you do pick up these symptoms, and the minister was saying you do an antigen test, is a particular easy to do, and then you continue to do a PCR test. If all those are positive, we take that sample into some of our laboratories, National Health Laboratory Services, and we do a genomic sequencing to just check what type of an Omicron or what type of a subvariant do you have. And that is going to actually keep us checking, because if we do still pick up that you are having the very subvariant, of course positive, but the subvariant that is circulating in the country, the subvariant that we have a vaccine against, then we still do not have to worry. It doesn't matter whether it is coming in from the Western Cape. We started that was we have not been able to follow up this subvariant that we are picking up in the Western Cape, where it came from. But it does not matter as long as it is a subvariant that is circulating, whose origin or whose association is Omicron, against which me and you and the rest of the South Africans are vaccinated against. We just need to be cautious and move on.
Of course, Dr. Dhlomo, what is encouraging is that, South Africa has achieved a high population immunity, which is very encouraging. But just from a surveillance perspective, given the fact that there is still vaccine hesitancy among some South Africans, particularly those that may have other underlying conditions, what efforts will your department be making in that regard?
Look, we are actually saying, Unati, we are calling upon, and some of the people are responding, all those South Africans who are immunocompromised. In the event me and you are not really caring that much for them, those patients who are having cancers, certain lymphomas, and certain very serious diseases, be kidney disease, heart disease, we would want them to be actually given more boosters. And those are the ones that we are saying, even though I'm not imposing on any mask to anybody, to you and me, maybe you can err on the side of just keeping a mask in the event Dr. Dhlomo is sitting next to me and is not really taking care of myself. But those are the ones that we are urging to go and come forward for more boosters, because we just want to make sure we improve the level of immunity. But again, we are calling all South Africans to make a responsible step. Just come forward and get vaccinated and get a booster, because in that regard, we are unlikely to go back to affecting our economy by locking down. We are unlikely to really restrain ourselves in terms of the enjoyment that we have received. And the first time we had an excellent Christmas and the festive season. Let's go on that trajectory by keep on vaccinating and making sure we also get boosters. It's a request we made to all our South Africans.
Very quickly, Dr. Dhlomo, before I let you go, in as far as boosters are concerned, there are obviously children that have been vaccinated, but there are also concerns around boosters. Please just help us understand what the concerns are around boosters. Can children get booster vaccinations as well?
Yeah, look, we are also saying those who are 50 years and above must get a booster. Those ones have already got 2 vaccines and then 2 boosters. Let them go for another booster. That means 3 boosters on the top of 2, so they have 5. The 18 to 49-year-olds who had 2 vaccines and 1 booster, so there's 3, we are actually encouraging them to go for another booster. But there is no evidence on the less than 17, the 12 and up to 17 years old, those who got the vaccines should, according to WHO, stay with what they have, because it was just to protect them and get them to be that protected. But there is no evidence that shows that we have this COVID-19 so much virulent or so much forceful on that age group. You'll recall, Unat, that this is the last group that was brought in on the vaccination scheduling again. So we are not boosting as yet the 12 to 17-year-old as yet.
All right, just final comments from you. So essentially the Gauteng, the South African Health Department basically saying that there is no need to panic following this new subvariant.
There is no need to panic. We are not imposing any restrictions on any South Africans. We are not also imposing any restrictions on the travelers from any part of the world. We are just encouraging and requesting South Africans to keep on improving their immunization status and improve their immunity by getting boosters and vaccinated. And that's it. If we do so, and just be, if you find symptomatic processes, get going, get tested, get checked, and then we'll take it from there. But there is really no need to panic. Let us respect and regard this process as a process that needs our support by vaccination and by observing pro-hygiene and all that. Then we'll go well. Thanks, Unat.
Dr. Dhlomo, thank you so much for your time this afternoon. Really do appreciate it. Deputy Health Minister there, Dr. Sibongiseni Dhlomo, of course, saying that there is no need to panic, but encouraging South Africans to get those necessary vaccine shots. And if you have received those 2 shots, then get a booster shot as well.